Everyone, welcome to the show. So the state of California is suing three major pharmaceutical companies and drug program managers. This includes Eli Lilly, CVS. This is for price gouging consumers for insulin. California Attorney General Rob Bonta announced at a press conference that he'll be filing this lawsuit, which accuses the companies of acting as an oligopoly. The lawsuit says that they basically conspired with each other to artificially inflate the price of insulin. And it notes that the drug managers, companies like CVS, Caremark, and others, receive, quote, significant secret rebates. They say this is for promoting these drugs. The lawsuit states that insulin is a, quote, century-old life-sustaining drug, yet the price has, quote, inexplicably risen several hundred% over the last 2 decades. The complaint also notes that the massive price hikes, quote, disproportionately harms low-income communities who must choose between paying for insulin or everyday necessities such as housing and food. And AG Bonta points out that these communities are more likely to be under or uninsured, and they're more likely to suffer with diabetes and require insulin. And that's, of course, because low-income communities have to rely on cheap government-subsidized foods, the very foods that cause diabetes, by the way. So the AG is asking the court to halt these companies' price gouging practices, and they're also asking for compensation for California residents for their overpayment of this drug. You compare the U.S. to other countries, and people in our country in the U.S. are paying tens to hundreds of times more than what people pay in other countries for the same exact drug. And as you guys may recall, California Governor Gavin Newsom also announced that he's going to, or the state of California, I should say, is going to be manufacturing and selling its own insulin at greatly reduced prices because of this issue. So everybody's tackling this one issue. I wish they would address all drugs, but I guess this is a start, because this is on top of the Affordable Insulin Act, which was created by Georgia Senator Raphael Warnock. So that bill passed in March of last year, March of 2022. That caps the monthly cost of insulin at $35 or 25% of the insurance company's negotiated price, whichever is lower. So the most that you'll pay is $35. The problem with that Affordable Insulin Act is that, as I understand it at least, it only applies to patients who have some sort of health insurance. So that's, whether it's a standard policy or Medicare. So the price cap doesn't apply to uninsured people, which is completely insane. So anyway, the defendants all claim they're innocent. They say, we look forward to proving our case in court. But the stats and the numbers don't lie. These companies are making massive profits, and they keep increasing the prices. So I have zero sympathy for these greedy bastards. So I'll keep an eye on this. I'll let you know what happens. Thanks so much for watching and listening. Please like, share, and subscribe. Please donate or become a monthly supporter. Love you guys. Take care, and I'll talk with you soon.